lot of things have happened between last year and this year, and I put this slide up just because I think to some degree we are at a crossroads for how we manage PRRS. We've been battling this disease 20 plus years, and it seems like some days we make headway, and there's a lot of days where we seem to take another 20 years backwards. There's some other big things that have happened, one of them being the stopping of the USDA PRRS CAP program. We had 8 total years of this NIFA-funded program, which was really heavy into research and looking at regional elimination. And unfortunately, that was not continued to be funded, so that will end basically as of June of 2013. As that was one of the cornerstones, or at least a big part of our activities, a lot of the questions that come up is, what do we do now? Where will the focus be? What do we look for management and control of PRRS, or do we focus on elimination and truly focus on that? And then what are going to be funds for activities? Who's got those dollars available? So what we're doing at the National Pork Board, that really concerned us as well, because we obviously have a research program for that, and our Swine Health Committee really oversees a lot of those activities. We've had a lot of discussions this year and essentially came up with an objective, at least as looking at our activities this year, that state what our objectives are, which obviously you can read. And it really is looking at the short-term impact on how we fund some projects, but also the long-term impact of how we deal with the disease. And that, I think you will see it down the road as we look at our current and future research objectives and other activities. So again, like I said, PRRS CAP's kind of winding down. Again, back last year, the tail end of last year during the IPRRS meeting, a group of us got together really to look at what are some of the funding needs and resources that are basically going to be left, and the gaps left by the PRRS CAP disappearing. And also we wanted to identify what are some of the critical needs that are unfulfilled that we need to focus on. So there was folks that were still from PRRS CAP, from pharmacy, from AASB, industry, and really just trying to come up with a basic outline of what do these key folks think we need to do. Also, we will participate. There's going to be a PRRS CAP wrap-up session in mid to end of June. We will be participating in that, again, to also learn and try to understand what are some of the gaps and unfulfilled needs out of that whole project as we move forward. And that will help, again, guide a lot of our research focus. So there's a lot of ongoing efforts. There's too many organizations really to mention here. I just listed some of the key ones, but also many different universities that are focusing on PRRS elimination, and then how do we fill these gaps. Some of the things that are being funded, there was a group, Jack Deckers out of Iowa State is going to be the one looking at the genetic resistance of disease for PRRS. So that is a project that was recently funded by USDA NIFA. I'm very excited that we will be on, myself and Dr. Chris Hosteller from Animal Science will be sitting on the stakeholder boards. So we will get to participate and get really to learn a lot of this really exciting information that's going on. I think everybody in this room knows there's still a lot of funding needs. Animal health in general is woefully underfunded. A lot of times we have been very blessed in PRRS research. PRRS CAP was funded at, I think, $1.2 million for 4 years, and that was times 2 because we had two PRRS CAP projects. Ourselves, we've typically had around $1 million a year. However, a lot of those funds are really coming under scrutiny, if not outright going away. So it's very important for us as an industry to continue to work together, and we work with folks like Boehringer Ingelheim, Zoetis, a lot of the universities, even with USDA, to try to identify what are other extramural sources of funding that we can utilize for this disease, even working with our northern counterparts at the Canadian Swine Health Board. So our main goal is to make sure that we leverage those funds and really avoid duplication as much as possible. Recently, within our Swine Health Committee, we formed a PRRS Subcommittee. We haven't had one since I've had my tenure, but it's been a big enough issue. We've had a lot of questions about that. We had some folks step up and say, we'd like to be interested in forming this committee, so we did. One of the main things, and I'll get into it a bit, is a literature review. So they're really critical involved in how we're starting our literature review. And then also going to look at critically how to control, manage, and eliminate the virus. One of the things on the agenda, and I apologize for those of you that are in the Swine Health Committee that haven't talked to you before, but one of the things that we're going to discuss in our upcoming meeting is looking at, do we develop a plan for elimination? And then use that plan as the basis of evaluating what are continued gaps, needs, and tools in order to get there. So we've talked to a lot of folks about that, and it's a good idea, so we're going to continue to look at that, use our subcommittee to bounce it off, and then go to the full committee. Another thing is looking at our surveillance. There is still a lot of discussion about what is considered PRRS positive, what is considered negative. Is there a gold standard for identification of a positive herd? So that's something that we're continuing to look at, looking at incorporation of oral fluids versus just your typical serology. So we're trying to really assess how do we get that to better serve the industry to have a consistent and standardized definition. Mapping, data integration, all of these things are ongoing in a lot of different regional projects. I think the big thing now is to be able to try to consolidate that and look at that on a national basis instead of potentially just having everything as a piecemeal. And it's a lot bigger project than it sounds, but that's something I think we need to look down the road to do. So the literature review. During our discussions on the 2013 research process, a lot of people were discussing that we really need to know where we're at. And even when I was discussing this with our previous working group and even with PRRS CAP, there's a whole lot of information out there. I think somebody did a quick research search and there's about 1,800 different articles just on PRRS alone from 2003 to current. So, and that doesn't even include things that were started in 1990. So we really thought we need to do a critical evaluation of literature that's out there in a couple different areas. So we're going to look at immunology, virology, vaccinology, and epidemiology, because those are the big four that we really need to focus on to help us understand what do we currently know, what do we not know, and then what do we need to do to develop a roadmap for PRRS and to help that along in the whole process. So we're utilizing our PRRS Subcommittee for that. We've got it pretty well honed in. Hopefully we'll start that process here in the next week or so. So that's something that's, I think, very, very critical. The other thing is that we will be having, I call it a little iPRRS, more of an informational PRRS. There are several of us that decided that we still needed to have a format. Typically we did one in June and then one in December, at least within North America, that helped producers, practitioners, researchers talk about, discuss PRRS. So there's a group of us that have got together, so it's ourselves with Port Board, we've got Bering Grangelheim, Zoetis, and even some of the folks at K-State running some of the PRRS CAP, and we are going to be convening a meeting in December. It will be in Chicago, it will be with, or not right directly with Crawdad, but it will be in association with that meeting, because there is value in having the PRRS group also being it with the Crawdad folks so that we can cross-collaborate and discuss all of our issues instead of being at different locations at different times. So watch for the save the dates, that will be coming out soon. So basic research focus, even though we're doing a literature search for this year to try to help us in future goals, there still is a need for basic research. Again, in discussions, not only with our committees, but other individuals, organizations, there's still a lot of issues that are left unresolved and we just don't have questions about. So this year when we developed our research priorities, we had them very, very specific. And I'll give you a link to that in a minute, but we're focusing essentially on immunology and virology. There's several key questions there, especially limited to how does the virus evade the immune system, because we still do not have a very good idea of that. How does the virus maintain persistence and why can we not seem to get ahead of it? Epidemiology and surveillance are another big one, again looking at standardization of testing and classification of the virus. And then lastly, requesting an economic impact, essentially looking at cost-benefit of elimination projects. Again, trying to get a bigger picture of how much does it cost. We know how much it costs when we get it, but how much does it cost, or how can we give producers an idea of what it costs to get rid of it over the long haul? So currently, if you're interested, we do have our research call at pork.org. The deadline for submission of projects is May 22nd, and then we will be selecting those during our committee meeting basically at the end of July. So there isn't a limit on the number. A lot of times we've had concerns from people because typically pork board grants run about 12 months. We can go to a longer extent, up to 2 years. It just depends on how our funding is allocated. But the committee understands that we do need to have ability to look at longer term projects and not just a 12-month basis. So this call, we do have it outlined from a 12 to 24-month proposal, as long as it's stated up front on objectives. But that is something that we are looking at, trying to encourage some people to do, or to look a little bit more in the future and long term. We published this book back in 2011. Again, if you have insomnia at night and you want to read this, it's a great one for that. And I say that because I geek out on it. But we do have our PRRS Initiative that summarizes everything that Pork Board's done essentially from 2004 to 2011. I've got to work with our IT folks. What we'll probably do is not reprint, but add to the book online as an online resource as we continue to collaborate between 2012, 13, et cetera, et cetera. But it's a resource that shows everything that the Pork Board and checkoff dollars have funded in the area of PRRS. So that is also available online, or in print if you want to just call me. So our 2014 plan of work, that's essentially when everybody and committees and efforts within National Pork Board get together and look at our budget for the following year and plan on where our needs are, what things are high priority, what needs to be funded, how does that funding need to get allocated. So really that's what we're looking at for this year, and a lot of it is looking at the facilitation and funding of research. One of the big questions comes up is we get sows and get herds negative. How the heck do we maintain these herds negative for PRRS? And that's something that's continues to evade and elude us. And so what we're trying to do is tailor a lot of our questions and needs. We've looked always in the research and scientific sphere, but now it's trying to get it down to the field. We had a discussion today, even on our literature search, we focused on a lot of benchtop research, and that's really good, but where we really need to go is continuing to push of how does the benchtop research get implemented on the farm, or why is there a disparity between how those two things happen? So that's something I think you'll see as a focus for us in 2014 and beyond. Even with our literature search ongoing, we're still looking at funding resources and funding research because, again, there's very limited amount of people that do that. So it is very important for us to help fulfill that need and to help keep research going and not have a gap or time lag in there. Obviously, issues with PRRS don't stop, so we still need to keep focusing on that. So we will be, seeking input from people, gathering feedback on priorities and research needs from a lot of our different stakeholders and producers. So just to summarize it all up, the National Pork Board and the Swine Health Committee is very committed to supporting the ongoing efforts for control, management, and elimination of the virus, and even for other diseases, because a lot of the things we do for PRRS can transition over to other diseases. But things like facilitate or host meetings on objectives with PRRS, seeking feedback, and then also this comprehensive literature review with the final publication of those key findings. And then also we'll maintain a lot of this information at our pork.org website as well as the PRRS.org website, because that's become one of the repositories for people to put information there.